Welcome. This is Buddy Amoroso, keeping District 8 great. Today we have a real honor. We have two very distinguished guests, and our first guest is Congressman Bill Cassidy. It's a real honor to have you here today.
Buddy, it's my honor to be here, and thank you for serving our community. I very much appreciate joining you.
I appreciate everything that you're doing. Now, what committees do you serve on, Congressman?
Great committee called Energy and Commerce.
Right.
And I'm on the subcommittees of Health, which fits my bio as a lot of our, hopefully folks know that I'm a physician who's been working with LSU giving health care to the uninsured.
Right.
Secondly, on energy and power. So for our state, which is so connected to the energy industry, energy and power is a great subcommittee. And the third subcommittee is called Environment and the Economy. So we have jurisdiction, for example, over the Environmental Protection Agency, which of course has jurisdiction over all the ExxonMobils, the Dows, the Rodeas.
Now, Bill, everybody's talking about the economy, about the budget cut. Where are we with this?
If in 1965, this is a pie chart of the federal tax revenue.
Right.
About that much went to Medicare, Medicaid, Social Security, and interest on the debt. Maybe that much.
Right.
50 years later, over 50% of this revenue, over 50% of that revenue goes to Medicare, Medicaid, Social Security, and interest on the debt. Within 18 years, 100% of federal tax revenue will be going to those four programs. Now, if we don't do anything, one, there won't be enough money for these programs.
Right.
And so there will actually be a decrease in amount of Social Security benefits, a decrease in Medicare benefits,
right,
if we do nothing, number one. Number two, there won't be any money for roads, highways,
right,
no money for community block grants, no money for levees and for dredging the Mississippi River to support our maritime industry. If you can just fill in the blank, no money for medical research, no money for education, all of it will be consumed by those four programs. So the question is, how do we preserve these important safety net programs that people have paid into their whole life, at the same time keep it from consuming the whole budget?
Right.
That is a challenge that will be before our country, before us as an American people, for probably the next 10 or 15 years.
Yeah. Now, as a healthcare professional, which you are, what about the new Obamacare? How is that going to affect our country? How is it going to affect your patients?
Yeah, it's an incredible concern to me. Already we're seeing it affecting. So there's three components, at least three components, but the big ones are Medicare, Medicaid, and then the private insurance market. Medicare, the Medicare Trust Fund is going bankrupt in about 12 years, give or take. And so this is the program that helps provide health insurance for those who are 65 and above. You and I have been paying into it. My mother's on it. That trust fund will be bankrupt. Obamacare took $500 billion from Medicare to spend it on the new Obamacare entitlement. And so we've got to restructure this program to preserve the benefits for those who are on it and also to preserve it for those who will be. There's a bipartisan proposal that was first thought of by John Breaux, Louisiana's own Democratic senator, that now Paul Ryan and Ron Wyden, a conservative Republican and a liberal Democrat, have co-endorsed. That would preserve Medicare as it is for those who are on it, but also preserve it for those who are going to be. The president doesn't like that plan, but he's not offered an alternative. So what we have to hope is, as the president kind of disses this bipartisan plan originally conceived of by John Breaux, as he says no to that, hopefully sooner or later he'll come up with his own plan. So far he hasn't. Medicaid is the program where the feds pay part, the state pays part. The question is right now whether Governor Jindal will expand it. Important program. It's, though, contributing to the state's tough financial times. That's going to be a tough one for the legislature and the governor. Private insurance market, people are being affected by that as well, in a variety of ways. Premiums are going up because of Obamacare. Some businesses are going to stop providing insurance to their employees and let them go into the exchanges. But the exchanges doesn't appear as if they're going to be ready when they're supposed to be. That is to describe what a Democratic senator has called it, a train wreck about to happen. We've got to make it better.